Okay, so our next speaker is Brittany Guerrini. So Brittany is a pediatric survivor of kidney cancer. Brittany's 28 years old, and she is part of our family at NYU. When she was 4 years old, she was diagnosed with stage 3 Wilms tumor, which is a pediatric cancer of the kidney. Brittany is currently a pediatric heme-onc bone marrow transplant nurse working full-time at NYU's outpatient heme-onc clinic, and per diem at MSKCC Pediatric Urgent Care Unit and Pediatric ICU. She worked for 3 years as an inpatient heme-onc bone marrow nurse at the Cohen Children's Medical Center, and ever since she was diagnosed, she always knew she wanted to be a nurse. Becoming a peds heme-onc nurse was just that much better. Brittany lives in New York City and is going back to school to get her master's in nursing education so she can teach new nurses when she graduates in 2020. Way to go.
I don't know if I should walk up or not. Well, it's a little hard to follow Allie because that was great, but I'm just going to tell my story of how cancer has been part of my life. So when I was 4, I was diagnosed with stage 3 Wilms tumor, which is a cancer of your kidney. So I had my left kidney removed, and I went through radiation and chemotherapy for about 15 months. I don't really remember most of it. I do remember a couple things very, very vividly, but it really was my parents who went through it. So I firmly believe that parents and caregivers and siblings are also survivors because they go through something that is so different yet the same as a survivor. So cancer has been part of my life for the past 25 years. I would go for my follow-up appointments. I was treated at what was Schneider's, now Cohen's. So it was very cool for me to start my career there as a nurse. I worked there for 3 years, and now I'm a pediatric oncology nurse. It's really amazing. I mean, I just try to use my story for good. I don't tell my story to all of my patients. Some of the doctors will pull me and they'll be like, listen, I have this diagnosis, especially if it's like the same as I had, and I'll try to talk to the parents, but it gets a little fuzzy. I try to do, anything I can just to make anybody's day a little bit better. I mean, just because you kind of know what you went through, you know what your parents went through. So anything that I could do, I just, does this kid want a slice of pizza? I'll run out and get him a slice of pizza. So I think I'm a little bit different in that way. I now actually run our survivorship group so I don't work at the cancer center. I work at the Children's Cancer Center. I guess it's affiliated with the cancer center. So I run our pediatric survivor group there. And it's just a bunch of, we're like age 18 to 35 of like pediatric survivors who just kind of talk about our feelings once a month. And that for me has been like a true honor. I started this year running that. But I went for my follow-up appointments till I was about 15 years old. And then I saw a survivorship doctor at my old hospital. It was hardest for me when I was a teenager because I would walk around, I have like a bunch of scars on my belly and my Metaport scar. So for me, that was really hard as like a teenage girl, just trying to like go to the beach with my friends and like knowing I was different. And, it was when I started dating, I had to really figure out how to talk to this new person in my life. And it's hard because you're trying to figure out yourself when you're like 17 and then let alone try to tell people this story. But I really think it's so important to tell your story. Any story that you have, I think, cancer sucks, but we can move past some of it. And I think if you can use your story for good, why not? I mean, it can make someone's day. And sometimes you don't even realize the things that people are going through or have been through until you tell your story. So I'm a really, really big believer in that. But I'm good now. I kind of just do what I want. Everything is in moderation, and we've lived our life that way. My parents have been so amazing throughout my life and trying to help me cope with whatever. There's always obstacles and stuff. But I've been cancer-free for about 25 years now, and thank you. I just try to, tell my story as often as I can and just try to use it for good. But being a nurse, always giving back, that was like my dream. And so I feel like I'm living my dream now, and I try to make the best out of a really bad situation. So.